Hey everyone, let's have another topic from pharmacology series which I recently started. Today's topic is autonomic nervous system or ANS. Let's have a look at it. Autonomic nervous system is a part of our peripheral nervous system and is responsible for regulating involuntary bodily functions. It controls processes such as heart rate, blood pressure, digestion and respiratory rate. The autonomic system operates without conscious control, ensuring that these essential functions occur automatically. Now, there are two types of ANS. First one is sympathetic and the other one is parasympathetic. Sympathetic nervous system is often associated with fight or flight response. It prepares the body for action in times of stress or danger. When activated, it increases heart rate, dilate airways, redirect blood flow to essential organs, and release energy stores to provide the necessary fuel for physical exertion. The other one is parasympathetic nervous system. It is responsible for rest and digest response. It promotes relaxation, conserves energy, and facilitates digestion and elimination. When activated, the parasympathetic system slows heart rate, increases digestive activity, constrict pupil, and stimulate other activity that aid in rest and recovery. There is receptor that is called as autonomic receptor. What happens? Both the sympathetic and parasympathetic system exert their effect through specialized receptors located on target organs. These receptors are categorized as adrenergic receptor for sympathetic transmission and cholinergic receptors for parasympathetic transmission. Adrenergic receptors include alpha and beta receptors, while cholinergic receptors include muscarinic and nicotinic receptors. Now let's see sympathomimetic. It is also known as adrenergic agonist, are drugs that mimic the effect of sympathetic nervous system. They stimulate adrenergic receptors, activating the fight or flight response. For example, drugs include epinephrine, norepinephrine, and isoproterenol. These drugs can be used to treat conditions such as low blood pressure or asthma by increasing heart rate, dilating airways, and constricting blood vessels. Another one is sympatholytics, that is also known as adrenergic antagonist. These are drugs that inhibit the effect of sympathetic nervous system. They block adrenergic receptors. It prevents the activation of fight or flight response. For example, the drugs include propranolol, metoprolol, and prazosin. These drugs are used to treat conditions such as high blood pressure, migraine, and anxiety by reducing heart rate, dilating blood vessels, and promoting relaxation. Parasympathomimetic or cholinergic agonist. They mimic the effect of parasympathetic nervous system. They stimulate cholinergic receptors promoting rest and digestion. For example, drugs include acetylcholine, pilocarpine, and methacholine. These are used to treat conditions such as glaucoma or urinary retention by stimulating smooth muscles and increasing salivation. Another one is parasympatholytic or cholinergic antagonist. It inhibits the effect of parasympathetic nervous system. They block cholinergic receptors, reducing the rest and digest response. For example, drugs include atropine, scopolamine, and ipratropium. These drugs are used to treat conditions such as excessive salivation, motion sickness, and asthma by reducing smooth muscle contraction and drying secretions. Now we have explored the different type of drug influencing autonomic nervous system or ANS. Let's briefly discuss their clinical applications. Sympathomimetic can be used to increase blood pressure, treat asthma, or manage severe allergic reaction. Sympatholytic are useful in reducing blood pressure, treating migraine, or alleviating symptoms of anxiety. Parasympathomimetic are used to stimulate digestion, treat urinary retention, or manage certain eye conditions. Parasympatholytic can be used to decrease salivation, alleviate motion sickness, or dilate airways in respiratory disorders. In conclusion, the autonomic nervous system plays a crucial role in regulating involuntary bodily functions. Sympathetic division triggers fight or flight response, while parasympathetic division promotes rest and digestion. Pharmacological agent can influence these systems by acting as agonist or antagonist on respective receptors. Thank you so much for watching.